Hello, my name is Rishab. I am studying in first year MBBS in Sri Chamundeshwari Medical College and Research Institute, Channapatnam. Today I am going to be explaining the mandible mentored by Dr. Noini.
So now let's look into the mandible. The mandible is the largest and strongest bone in the face. It develops from the first pharyngeal arch. It is a horseshoe shaped bone. Now the mandible is divided into two parts. One is the body and another is the ramus of the mandible. The body has two borders and two surfaces. The upper border here is also called the alveolar border, which has sockets in which the teeth get embedded into. And here is the lower border. The surface is, one is the outer surface and one more here is the inner surface. The outer surface, the two halves of body of mandible fuses here at the symphysis menti. The two protuberance here present is called the mental protuberance. The foramen which we see here is the mental foramen. Now let's look into the ramus of the mandible. The ramus of the mandible is quadrilateral in shape. It has two processes, four borders and two surfaces. The tapering process here is called the coronoid process, backwards of which lies the condylar process. The condylar process is expanded from side to side, forming the head of the mandible. Below the head of the mandible is a small constriction called the neck. The head of the condylar process contains white fibrocartilage, with which it articulates with the temporal bone of the face, forming the temporomandibular joint. Now if we see the medial surface of ramus of mandible, you can see the mandibular foramen over here. The inferior alveolar vessels pass through this mandibular foramen, enter into the mandibular canal and moves into the body and exits from the mental foramen as mental nerves and vessels. Behind the symphysis menti in the inner surface, you can see that some tubercles over here. These are called the genial tubercles. It has usually 4 in number. The upper two genial tubercles houses the attachment for genioglossus muscle and the lower two tubercles for geniohyoid muscle. Here near the mandibular foramen you can see a ear-like projection. It is called the lingula. It gives attachment to the spinomandibular ligament. Here the depression small we can see here is called mylohyoid groove. And the line present over here is called the mylohyoid line. This mylohyoid line gives attachment to the mylohyoid muscle. Below the mylohyoid line, we can see a small depression over here. This depression is called the submandibular fossa, which houses the submandibular gland. Above the mylohyoid line, we can see one more depression over here. It's called the sublingual fossa, which houses the sublingual gland. Here at the base of the mandible, one more depression you can see over here. This is called the digastric fossa, present on both sides. This digastric fossa houses the attachment for anterior belly of both the digastric muscles. Now let's see the muscle attachments or the ramus of mandible. The ramus of mandible gives attachment for the muscles of mastication. Muscles of mastication include 4. One is the temporalis, masseter, medial and lateral pterygoid. The lateral surface of ramus here, most of the part is occupied by the masseter muscle attachment. In the medial surface of the ramus, over here at the angle of mandible, you can have the attachment of medial pterygoid. In the anterior border of the ramus, it gives attachment for temporalis muscle, and the lateral pterygoid muscle is attached over here. That is the neck of the mandible below the condylar process. These are the 4 muscles of mastication. The anterior border of ramus continues over towards the body, that is towards the mental foramen like this. This is called the oblique line. This oblique line houses the attachment for buccinator muscle. Here in the body of mandible, below the incisor teeth, you see the incisive fossa over here next to the symphysis menti. This incisive fossa houses the mentalis muscle. The mandible gives attachment to three ligaments. One is the stylomandibular ligament at the angle of mandible over here. The stylomandibular ligament. And the lingula here, ear-like projection over the mandibular foramen. This gives attachment to the spinomandibular ligament. One more ligament called the pterygomandibular ligament. It's present behind the third molar tooth over here in the medial surface. Behind the pterygomandibular ligament, we also see the attachment for superior constrictor muscle. So the three ligament attached to the mandible is the stylomandibular ligament or the angle of mandible, spinomandibular ligament at the lingula, and the pterygomandibular ligament.